start with ribs, and I'll show you from the beginning to end. So, Tracy?
Hi.
Hi, Tracy. I'm Louise. I'm going to be your radiographer. So, Tracy, why don't you come into my room so I can go through this with you? So, could I have your full name before we start with middle name, please?
Tracy Nicole McCarthy.
Okay, and your date of birth?
12/12/92.
Okay. And have you removed everything from the waist up? You have no piercings, you don't have a necklace on?
Nope.
You removed your bra? Do you have any tattoos that I should know of?
No.
Yes. Okay, good. So you removed everything, great. So I have to ask you a personal question. Is there any chance you could be pregnant?
Nope.
Okay. And did you fall and hurt your ribs?
Yeah, I did.
Yeah. Which side? Is it
It's this side.
the right side?
Yep.
Okay, can you show me exactly where it hurts?
Like around here.
Just one little spot right there?
Yeah.
Okay.
Yeah.
I'm gonna have you put a BB, or I'm gonna put a BB, whichever way they want you to do it, right where it hurts.
Okay.
If you could just place that, that would be great. Right where it hurts, great. Okay, so what I'm gonna be doing is 3 x-rays of your ribs today. I'm gonna take a chest x-ray of you, and then I'm gonna be doing 2 other views, and I'm gonna turn you a little bit.
Okay.
Okay, so do you have any questions?
No.
All right, so I'm gonna have you come in here. So it is your front on your right side. So I guess what I'm gonna do is I'm gonna have you face this. Just step up a little bit to it, I'll get ready for you. Actually, Tracy, you know what, I'm gonna have you step aside. Just gonna make sure that. Please. That's it. Can't see it. Just a little piece of paper. It was locked down. It's a little bit off center, but not too bad. Okay. All right, Tracy, I'm going to have you face this. I'm going to be doing PHS first, bump the sun. Now I'm going to have you put your chest right against that. And I'm going to have you turn a little bit towards, onto your right side a little bit. Oh, wait a minute. No, we're going to do LA. There you go. I'm going to have you turn this way. I'd like you to put your arm up here. And this one just away a little bit on your hip. I'm just going to bring this down. So she explained her right ribs were hurting, so I'm doing an LAO, upper and lower. I'll show you the POs too.
And you're going to tell us whether we're doing AOs or POs, or we make that choice?
I will tell you. You might have to make that choice, but I think for those who are interested in your position and figuring it out, and if you ever question it and you need to, okay, good. And you would need to ask your tech, okay, just for now, the check. So I'm about 1.5 inches above her shoulders with my IR, and she's put a BB on. Now what I'm most interested in is that I'm not going to clip her in the top. I'm not so concerned about the bottom because we're going to do another one. She's about 45, between 45 and 30. I just want to make sure I have enough light field that I'm not going to clip the side when she takes in a deep breath. That's pretty much how I send her. Okay? Yeah, I'm going to put the lead shilling. By the way, this has to go very close to the patient. I think that came up last week where some of you had placed it like this. I think I questioned you, but I checked it out with some of the techs. Shouldn't be too much space between the lead and the patient when you're using the rolling. Okay, Tracy, you're taking a nice deep breath and hold it in. Click. You can breathe. Relax. You see, just like that. I'm going to move this down. Whoop, sorry. And for Tracy, you're actually not going to be moving it very much. Okay, so you might get all of the ribs on the first one. So I would check her upper on someone this size. I would check the upper before I did the lower, just in case it all worked. And the thing is about the lower is that we need to make sure that, I think I only moved maybe what, not even an inch on her. So see, I'm right down, I'm actually a little bit below. Here's her crest, so. So it does really change the centering. So I'm not so sure I'm gonna have you do 11s. So 14. Okay, let's step back just a little bit. At the bottom of the rib here? Yeah, so we're really close. So, you know what? Don't do any collimation just because I might be misguiding you into centering. So if I was to do a smaller film, just to give you some help, if I was requested that I had to do 11 by 14, I would center right about curve of the rib on her, lower than what they're saying, okay? So that I could collimate, make sure I get it, like this, and I'm not going to clip her bottom. That's the only problem I have with the new way that they're telling you to center for the lower ribs. Is if they require you to use a smaller field, smaller film, or collimate more tightly, I would shift my centering down, just so you know that. For lab, just let's do what Meryl says, okay? So I'll bring it back up and open this up and bring her over. Make sure I'm not going to clip the bottom of her. A little bit more, okay?
So, you're at 14, 17 now?
I'm at 14, 17. I'm just concerned because the central ray doesn't work. If you're going to collimate smaller, you're going to have to shift your central ray. Okay? And unless you want to do it. Okay. We'll go by Meryl's. We'll go by Meryl's, okay?
So you're
But
just
no-
doing bottom of the light field at the crest?
Yes, bottom of the IR. Actually,
Sorry.
if you want to use that, it's minimized. It kind of gives you a range. But the film is actually below her crest.
So it'd probably
And
be
it's just
easier.
her body habitus. I wouldn't, if I bring it up, then we're going to be back where we started with her, okay? Which is for the upper ribs. Remember, the reason why, are you okay?
Yeah.
Okay, the reason why we need to do lower ribs is that technically you have to illustrate lower ribs over the abdomen. So we need to bring the central ray down, we need to increase, well, technique is going to increase naturally, okay, when you go from upper to lower. Do you remember when I said something about how we used to do ribs with technique, to give you an idea? That we would do upper ribs at 60 or 65, and then we would, when we set technique, and then when we did the lower, we would bump it up to 70, 75 for the abdominal ribs. So that gives you an idea of the difference in technique. Does that make sense?
Someone as small as her, like you said, you could get it all in one picture and not have to do the lower?
If they accept it. So the problem is, you want to relax around?
Sure.
Yeah. The problem is that even though we might get her all on the image, are her lower ribs well demonstrated?
Gotcha.
So not only did I get them, yeah, but the lower ribs are whited out because I'm focused on the upper ribs. That would be you would have to do it. And that's why we always had to do lower, even if we got them on the upper. Because of the different densities, we couldn't get them all well defined. Does that make sense?
Yep.
Okay, so that's the AO. Okay, so you're going to go by what Meryl says for lab. Now, if she had a left-sided problem, see how you have to really be careful because it's easy to do the wrong side. You have to really slow down and think about it. So let's turn you around. And let's do, so you have a pain on the posterior aspect of your left side.
Yeah.
Okay, good. So I'm gonna put you over a little bit like this. So did you fall?
I
I
don't know.
We were at the airport on Saturday night?
I was. I was doing a
dear.
drug run.
Oh dear.
I have that on video.
Okay, and the thing with Tracy is she is of that body habitus that you can manipulate your central ray a little bit on her. But if I'm doing POs, so I'm gonna have her back to, I'm gonna have her bring her arm up, kinda like that. This one away and on your hip. I'm gonna rotate you this way, a little bit more. So notice how, I mean, we're not even, so if this is mid-sag, this is her lateral aspect, we're supposed to come this side, we wouldn't be doing that, we're actually gonna come right in the middle of her. And I am going to put the up on the upside, the marker on her up for her uppers. Whoops. This thing is heavy. I want to be careful it's not too high that I'm going to clip her lower ribs. Okay, lean forward just a little bit more. Good. Take in a nice deep breath. Hold it and click. You can breathe. So we'll go lower ribs. The marker on the bottom for the lower, up for the upper. Okay. Very good. So can you take a deep breath in? Now blow it all the way out and hold it out. Don't breathe. And click. You can breathe. Those are ribs. So one of you going to do, well, the choices are going to be an RAO up and lower, an LPO up and lower, an RPO up and lower, and an LAO up and lower. Did I say them all? One set out of the 4. So a right anterior leg or a left anterior leg, upper and lower. Or a LPO and RPO. So I'll have 4 cards, you choose one of those. So you may get an upper, you may get an anterior, or you may get a posterior, you don't know. Sneaky.
So for that one, you centered more right here.
Just because of the body habitus. So let's say this is what
Would you
Meryl's.
normally have been on the other side?
You know what I would have done for her actually? I would have gone like this, and I would have come in. So it would have been more like what they said, but I would have collimated in just a little.
So
But that's
technically, we
me.
are supposed to be on that down side.
For the POs,
With the central ray.
yes. It
'Cause you
depends
were on
on,
the opposite side for her, and I was like,
right. So remember what I said, you don't go by the central ray that Meryl's told you, because it's gonna throw you. So if we did what they said, this is where we would be, almost, right?
yeah.
That's what they say.
So you're saying they'll use the light field? Don't
Use the
the-
light field, don't use that long axis line.
No.
Could just have a little bit of light on the.
Just have a little bit, because I've got her posterior attachments right here, all the way to the front, that's what we want to see. So it's, I think the AOs work out